Look, today I want to just concentrate on the public health, the relationship between the urban environment and public health, and try and get the minds thinking there about what we can do in the West moving forward. Now I want to start off setting the scene by just clarifying the role of the health department in this area. People often ask, well, what's the health department doing talking about water and green spaces and the environment? Most of the focus is generally on the environment, and I think we're probably unique in Victoria, coming out and spruiking the importance of the urban environment and the benefits we can get in public health. But I'd like to start by just going over the principles of our new Act that came out last year and is just coming into fruition this year. And I think it's important that we stick to the principles of the Act to ground my presentation here and to ground our work moving forward in the years to come. It's important that we do focus on a strong evidence base, that we look at the literature and we apply that to the interventions we put in place. The precautionary principles often thrown into these debates. You often hear it when people are sort of got a community group together and advocating for interventions in their area. But the precautionary principle is all about not waiting for full scientific evidence before we act. And I think Greg's articulated well the climate change evidence here that we've heard for many years, but there's still sceptics in place. But from a public health point of view, I think the weight of evidence is that climate change is here and we have to act. So we need to keep that in mind. Primary prevention. The health department now is all about prevention rather than waiting to act. It's not about putting all our effort into remedies. Let's prevent things before we need to actually act. Accountability is important. I'm from the government. I'm not going to be as inspiring as Greg. I need to be fairly conservative in what I say here today representing the government. I need to stick to the facts and be accountable for what I say. And it's the same for the water authorities, and I suppose getting back to Anne's presentation about the cost, we've got to demonstrate a cost benefit. We've got to be accountable for our actions and not just act without a strong evidence base and without demonstrating a sound benefit. Proportionality, I think this is a key to my presentation today. The Act requires us in the Health Department to act proportionally to the risk, and hopefully we've seen an overwhelming argument here from Greg about the issues that are out there, and there's a strong case for quite substantial interventions. And from a health point of view, I'll go through some health data here today, and I think hopefully I put together a strong case that the proportion of intervention needs to be pretty substantial in this area. And once again, sticking to the theme, collaboration is very important, and we're required under our Act to work with government, industry, business, community and individuals within the community, and that's certainly a strong theme of City West Water, and that's why we're all here today, collaborating. But moving forward, many of you have known me as a public health regulator, and typically as a public health regulator, historically, we've looked at acute disease. So we've got gastro in the community, we've got contaminated food, we've got contaminated water. We get out there and try and fix it now, and it's about preventing acute illness. Now, getting back to the proportionality issue, most of the disease now in the community is chronic disease. The cancers, cardiovascular injuries, mental health is becoming more and more of a concern to government, diabetes, etc., etc. And if we look at where disease has its biggest impact, tobacco is still the biggest cause of chronic disease. So if we all gave up smoking, we would have a substantial impact on improving health and reducing the cost of health on the community. But increasingly, obesity, blood pressure, alcohol is catching up with obesity as our interventions in tobacco have become more and more successful. Now, I've got circled there, physical inactivity is an important area where our urban environments can play a significant role, and we'll talk a little bit about that moving forward. Okay, taking that theme forward and helping Greg work out the costs of health and the environment, there's a raft of evidence around about the cost of lifestyle diseases on the health budget and on the community as a whole. Sedentary lifestyle, 50% of adults are not active at all, and that, as a result, has a substantial cost burden on the health system. Those costs are on the incline. Deaths there, we know that about 8,000 and increasing deaths per year happen as a result of the lack of physical activity. That's in excess of $400 million directly on the health budget, let alone on other costs that aren't that easy to calculate. Physical inactivity is ranked second now to tobacco and will soon take over, as I said before. Now, what we know is a very small amount of activity will make a huge difference. 30 to 40 minutes of activity 3 to 4 times a week is enough to change your health. And so 50% of people who are inactive, if we can get a substantial percentage of those people to do 30 to 40 minutes of activity 3 to 4 times a week, we're going to make a huge difference. And Greg's active corridors is something that we're very interested in, and we'll talk a little bit about that moving forward. Okay, carrying that theme forward, the World Health Organization and many other agencies and research organisations know what determines health. It's well established. Now, I've highlighted some of the things that I think are important to follow on from Greg's presentation, where we can make a difference here in the West. Now, we know right on top of that list of the determinants of health, the social determinants of health, is a good environment. Where we live makes a difference. If we live in an environment with good amenity that encourages physical activity, we're going to be healthier. That's well and truly established. It's particularly the case for young children. If young kids grow up in a green environment where they can get out and enjoy the outdoors, get in contact with nature, they're going to be a lot healthier throughout life. They're going to be, they won't have the obesity problems, they won't have the chronic disease problems. Okay, friendships and social cohesion is another important thing. Mental health is now becoming a more and more important issue that we need to address in public health. We know that friendships and social cohesion is a big factor in preventing rates of mental health increasing. So if we've got nice communities, green environments where we can get out, become friends with the neighbours, work with the neighbours in voluntary activities, sporting activities, local groups, that's a significant impact against mental health. Okay, and the last one I've got highlighted there, following on from Greg, is the need for healthy transport systems. So that's quite a big theme, and it's largely about public transport, but we're learning more and more about the importance of active transport systems. So we're very lucky in Melbourne in that we've got natural active corridors, transport corridors with our streets, Moonee Ponds Creek in my situation, the Maribyrnong River in Greg's situation, Gardeners Creek, the Yarra River, Mary Creek, etc., etc. There's natural corridors right throughout the spokes of Melbourne that should be invested in to encourage physical activity, walking, cycling, social cohesion, getting out there and enjoying nature. Okay, I suppose the case study I want to use today, moving on, I could spend an hour talking about physical activity and open space and give you some data about the cost benefits of investing in open space. But in the time I've got here today, I do want to concentrate on the urban heat island effect as the case study and taking Greg's presentation into some detail to see where we can actually make a difference with some of the work we're doing at the moment. Now, getting back to January, February 2009, we had a heat wave there where we got in excess of 40 degrees for 3 days in a row. But during those four to 3 days from, the 27th through to the 30th of January there, we were reaching temperatures of 45 degrees Celsius with an overnight minimum of 26 degrees Celsius. Now, we know we've done a lot of research following this event, and we know when we get a mean temperature in Melbourne above 30 degrees Celsius, people are going to die. We know that for a fact. No arguments. So mean temperature being maximum daytime temperature, minimum following nighttime temperature, and the mean of that. So when we go above 30 degrees, we get a spike in deaths. No debate, the evidence is in on that, or the jury's in on that. Now, in this situation, we had, as Greg said before, quite a substantial number of deaths. So if we go through to some slides to look at the health impacts of that, you can see there during that time the spikes in ambulance call-outs in relation to heat-related illness, so heat stroke, dehydration, heat stress. And you can see the correlation there between the daytime temperature with the red line and the bar chart there. And the one that we worry most about is the heat stroke, because heat stroke is a very serious health, and that's where people die. Okay, Metro Ambulance activity there. You can see once again the red line's the maximum temperatures there, and we've got the correlation between the summer of 2008, 2009 and the previous summer, and you can see the spikes there in late January in relation to call-outs with heat-related illnesses. Okay, this is the slide that Greg had up in the corner of one of his presentations, and this is the one that I think hits home the hardest. And you can see there that there's a bit of a lag period between the temperatures increasing and deaths. Now, the normal deaths you see there with the blue line, it basically it's fairly stable at just under 100 deaths per day in Victoria. Now, when we had that heat wave, a bit of a lag, and we were up to the 200. So deaths doubled when we started to hit those extreme heats. Now, when the evidence we've got at the moment is when we get that mean temperature of around about 30 degrees, we're starting to get 10, 20, 30 extra deaths in that as a result of the mean heat things. Now, as a health department, we want to know who, why, where, how, etc., what we can do about it. The Chief Health Officer, John Carney, initiated an investigation into those questions following that heatwave, and the evidence came out quite strongly that as Greg hinted at, the people most at risk are people over 65 years of age and infants. They were the groups that died. The other interesting things that could start to help us to intervene in this area were things like unfit, overweight, the old story, but more importantly, people living alone, the type of housing that are people in, and the theme of today, the urban environment. Okay, so where we had urban heat island, where we had hotter suburbs, people died more in the west than in the east of Melbourne. Very strong evidence in that regard. Okay, so people need environments to support good health. As I've said, evidence of people that live close to green spaces undertake more physical activity and are healthier. The evidence is quite strong, indicating that. Well-designed open space, restorative, reduce mental fatigue and stress. Parks and open spaces also provide places to socialise, explore, have fun, hang out with your friends and the sort of the younger kids, the teenager kids, get away from mum and dad. All good social activities to build resilience and social cohesion. Water-sensitive urban design reduces the heat island effect, and we'll carry on more with that in a minute. But basically, the point that we want to push in the health department is that green infrastructure requires reliable sources of water. Now, what we've found in the past with the drought and the water restrictions that followed is that basically our water supply systems are linked to our drinking water reticulation system. So the first thing that government does when water starts to dry up, I suppose, when our drinking water resources decline, is the first thing that suffers is we put water restrictions on our green resources. So there's laws that come in that prevent us using our drinking water to irrigate these essential green infrastructure and assets that we have in the community. And as a result, there's health consequences, poor health consequences. So from our point of view, we're very keen on advocating for alternative water supplies that aren't connected to our drinking water resources, that aren't going to be impacted by water restrictions when we have droughts in the future. We know we're going to have droughts in the future. Greg's made that case quite strongly. So we want to see secure alternative water supplies, local water supplies, to retain and maintain these important green assets. What does the health department like to see to reduce the burden of disease? Water-sensitive urban design as a key asset to mitigate against heat island, and we'll go into a case study shortly. Access to quality open space, and the access issue is an important thing that we probably need to understand more. I think Greg started to talk about access to the organ pipes through walking trails and things like that. I think that's the important thing. The reading that I've done, I've heard things about 500 metres, 1 kilometre, 2 kilometres, but what I'm reading and what I get out of it personally is there needs to be no barriers between where you live, where you work, and places where you can recreate. So, freeways are a huge barrier. If you have to walk around a freeway, you're not going to go to the park that's on the other side, the old story. I think that theme's been around for as long as I've been studying in the 80s. So for me, barriers are about being able to ride your bike, to actually walk there in a nice, comfortable way without any barriers. Green corridors, which we've talked about. Functional spaces, I think we need to do some more work on what are the characteristics of our open spaces that will actually encourage people to get out there and use them and take advantage of them, be active in them, walk, run, meet their mates, etc. What is it about open spaces that will change people's behaviour? I don't know. What I do know is that if I come up with an answer, it's not going to be the right answer. I think that's where collaboration comes in. The people that live around that park, or live and work around those spaces, they're the people that know what their space needs to look like, what it needs to have to get them there. So that's where collaboration comes in. Alternative water supplies. I've said what we in the health department believe should be our focus there. Strategic water plan, that's why we're here today. So thanks Anne and City West Water for taking the lead on that and collaborating with the groups that are here today and community and individuals within the communities. Now, I gave this I've given this is a shorter version of the presentation I normally give in this area, but what people have asked me generally in relation to this presentation is we need health overlays. We need to know where people live that are over 65. We need to know where people that live alone are. We need to know where people that are overweight are, etc., etc. We need to know where low-income people are that are most at risk. So we've been locked away for the last couple of months during the quiet period with the change of government doing some work in this area, and I want to share that with some the preliminary work in that area with you today. So hopefully that's a bit of a busy slide. That's the busiest one. So I apologise for that. It's probably fairly hard to see. I can't even see it here. But look, it's important we start off with population. It's proportionality. Put your efforts in to where you're going to get the biggest bang for your efforts. So I suppose the starting point are, where are the populations going to be moving 20, 30 years forward, where we can focus our efforts, and what are the age, what are going to be the changes in ages, because we know that as we get older we're more at risk, and we always know that the young are at risk too. So there's some slides there that are difficult to see, where there's some significant changes in population. So slide A, the top one, here's the youngsters. You can see that it's probably a fairly stable population in that age group moving forward. Some sort of slight growth there out in where we've got the growth corridors, probably out in the Melton area. Okay, but look, focusing on the elderly age 65 plus there, you can see there's some significant, there's going to be some significant ageing in our area here. Okay, low rates of physical activity. You can see they're looking at City West Waters area, which is the green bounded area. As we get into the darker spaces, we're comparing type 2 diabetes, which is the hatched area, with low rates of physical activity. You can see Maribyrnong and Brimbank in this area are areas of concern. Low rates of physical activity compared to high rates of psychological stress, that mental health theme moving forward. Once again, Maribyrnong, Brimbank in our area is of concern to us, with a hatched area there. Low rates of physical activity and high rates of overweight, the obesity issue. Brimbank, once again, Maribyrnong. Okay, population with low rates of physical activity and low health status. You can see Brimbank once again, and Hobson Bay councils are areas that we'd like some sort of understand more about how we can make a difference there. Okay, let's choosing one council out of that area, and we chose Maribyrnong, or I've chosen Maribyrnong for this presentation. It had sort of more diverse population, although from a socio-economic point of view it was probably better off than most councils in the West. There was some quite diverse issues within Maribyrnong. So we look at this one and focusing on the urban heat island, where we've got persons most at risk are aged 65 plus and living in flats, units or apartments, so more likely to be living alone. You can see an area out there towards the west of Maribyrnong, where there's some quite high density in particular pockets there, and we've got them circled. Now that pocket again comes up when we look at level of disadvantage, so socio-economic status, and people 65 plus. So people that probably can't afford an air conditioner, can't afford to get out and travel to cold places, cooler places and things like that. Same pocket. Okay, high levels of flats, units and apartments, so people living alone, and high rates of disadvantage, same pocket. Okay, there. The numbers in the boxes are the numbers of individuals living alone, or living in those sort of, likely to be living alone. Okay, disadvantage, a non-English speaking background. Once again, you can see Maribyrnong, how it's a very diverse community, but for a health planner and a social planner, there's some priority areas here that are coming out from the census collection district data. Okay, so just finishing up, that's the area that comes up in every one of those slides where we think from a health intervention point of view needs to be a priority area, particularly in relation to urban heat island. Now, my eyes are failing me as I'm getting older, but there's 3 or 4 open spaces there look extremely denuded, and I can't see much greenery in that suburb where these people are at risk. And I'd like to see a similar photo of one of our suburbs in the east or other parts of Melbourne. I wouldn't think that it looks the same. But I'd just like to leave you with that thought. There's an aerial shot off Google of, I think from a health from a health point of view, where the priority should be. And we spoke largely today about green developments, new developments, the growth corridors, but from a health point of view, we don't want to neglect existing suburbs and existing problems. We believe we can do a lot of work in that area.